In this video, we will be covering a SLAP Type 2 rehabilitation progression from directly out of surgery to return to play. Although this video will not include every exercise that an athlete would be performing through this sometimes 10-month process, it will give us an idea of some progressions and how we can individualize programs based on the athlete. In this case, we have an outside volleyball athlete who has undergone an arthroscopic SLAP lesion repair. Each phase will be included with at least one exercise the athlete will be doing with the clinician during rehabilitation appointments, as well as at least one exercise that the patient will be able to do on her own at home. You'll see that many of the exercises build upon one another throughout different phases. This has a lot to do with what is reasonable at the time, depending on the phase and stage of healing that the athlete is currently in within each phase. There is also a concept of neuroplasticity, where the brain begins to form and recognize synaptic connections, especially in response to learning or experience following injury. Because the brain is able to make these building block connections, it makes sense to progress as such during rehabilitation. Phase 0 will take up the first week post-op. The main goal is to protect the anatomic repair as well as work to decrease pain and inflammation. Light exercises can be done above and below the glenohumeral joint. Examples include gripping exercises with a rubber web as shown, as well as resisted wrist flexion with a 1 to 2 pound weight. Phase 1 will last from weeks 1 to 6. Goals include to protect the anatomic repair, prevent negative effects of immobilization, promote dynamic stability, and diminish pain and inflammation. Example exercises include passive flexion with assistance from the clinician, as well as table slides to promote increase of range of motion while still protecting the repair. Phase 2 will last from weeks 7 to 14. Goals include restoring full range of motion by week 10, preserving the integrity of the surgical repair, and beginning to restore muscular strength and balance. Exercise examples include prone horizontal abduction to external rotation with an emphasis on promoting scapular stabilization, as well as wall push-ups. A side note, these two exercises will be performed towards the end of Phase 2 when full range of motion has been obtained. Phase 3 will last from weeks 14 to 26. Goals include maintaining range of motion, improving muscular strength, power, and endurance, gradually improving agility, and gradually initiating functional activities. The first exercise is a progression using the body blade. Each motion will need to be able to be maintained before moving on to the next. As this promotes stability, the first few motions may even be included in Phase 2. The final progression includes D1, D2 patterns with the body blade. This phase will also incorporate progression from the wall push-up to either an incline or flat on the ground push-up, depending on where the athlete's strength is. Finally, we can incorporate sport-specific activities into rehabilitation. While working on balance and core stability, the athlete can, instead of catching a ball, which would not be useful for volleyball, practice setting while balancing. Phase 4 will last from month 6 to about 9 until the athlete has returned to full participation. Goals include a gradual return to sports activities, maintaining strength, mobility, and stability, maintaining cardiovascular endurance, and increasing speed and agility. First, we see push-ups using a TRX, which will require more stability and focus than with both hands on a flat surface. The athlete can also perform planks with a step climb in order to work on core stability, scapular stabilization, and strength. And finally, we see a blocking drill. The athlete should also work towards other motions such as hitting with a full approach, jump serve, passing, diving, and setting without the pressure of practice or a game before progressing to minimal then full practice.